The way a nation's principles and health structure are organised affect how its people access healthcare. In some countries, healthcare is viewed as a social right. Australia's policy is centred on universal care, meaning all citizens have equal and equitable access to necessary resources to look after their health and well-being without discrimination. The positives are its citizens are protected to seek necessary medical treatments without falling into poverty due to mounting medical bills. The negative is this system can be costly to a nation's GDP and the pressure on resources can be high.
Public insurance is designed to help reduce the financial risk associated with injury and illness to individuals. Australia's Medicare system is a compulsory universal health insurance scheme based on the principle of equal access to all Australians. Through the Medicare system, 85% of the appointment costs are covered by Medicare, with the patient paying the remainder, known as the gap. Patients also have the option of accessing bulk billed services, where the practitioner only charges a scheduled fee and the patient pays no more. Families are protected by the Family Safety Net, which, once a threshold has been reached, grants reimbursements of 100% of the appointment cost. Australians also have the choice of opting into private health insurance. Private health coverage in Australia is not required. However, in an effort to reduce the strain on the public health system, the Australian government offer a 30% rebate for those who do take out private health insurance. Private health insurance does not negate the Medicare coverage, and access to the public health system is still available to those who opt for private cover. Private health insurance allows for rebates for treatments by allied health professionals, dentists, and services such as in-home nurses. Those with private health insurance have more freedom of choice with doctors and hospitals in both the private system and the public system, as well as shorter wait times for treatment.
Rural health is a very important issue in Australia because the country's size and distance from the capital city and rural centers. People living in rural areas have shorter lives and higher levels of illness and disease than those in major cities. The Australia Institute of Health and Welfare has reported that remote has higher death rate than major city, which depends on difference in access to the service. For individual and group risk factors, also living environment of regional and remote area can impact health problems. In addition, the availability of many health practitioners, GPs, and specialists is much lower in rural and remote areas than in major cities. At the Commonwealth level, the Rural Primary Health Service program is intended to improve access to primary and allied health care service and activities for rural and remote communities. In contrast, rural Australians generally have higher levels of social cohesiveness. For example, higher rate of participation in volunteer work and feelings of safety in their community.
During the years 2013 to 2014, 9.7 million hospitalizations occurred. 3 in 5 were in public hospitals, which equates to 59% of the 9.7 million. This is only one fact that displays the high dependence behind public hospitals. In the years 2013 to 2014, the Australian Institute of Health and Welfare counted 728 public hospitals around Australia, which included 40,000 beds in major cities and 1,700 beds in rural and remote areas. Public hospitals were funded $44 billion in the years 2013 to 2014, which came from a number of different sources. The government and Australian taxpayers predominantly fund emergency and outpatient services, whilst admitted patient services are funded by non-government sources. The services which are included in public hospitals are emergency department services for not admitted patients, as well as planned care, maternity services, and surgical services for admitted patients. Within Australia's public hospitals, 287,000 full-time staff were counted in the years 2013 to 2014. Of this figure, 45% were nurses, 13% were medical officers, and 14% were allied health professionals.
Often referred to as the first level of contact individuals have with health services, primary healthcare refers to an approach to healthcare which takes into account physical, psychological, social and cultural aspects of a given individual when providing treatment and care. The term primary healthcare rose about in September of 1978 at the International Conference on Primary Healthcare. Adopted at this conference was the Declaration of Alma Ata, which expressed the need for urgent action by all governments, all health and development workers, and the world community to protect and promote the health of all the people in the world. Primary healthcare services are most commonly accessed in community health centres, general practices, and hospitals where you'd find GPs, nurses, pharmacists, and other allied health professionals. Both public and private sectors of healthcare play equally important roles in the funding and provision of primary healthcare services.
The Pharmaceutical Benefit Scheme is a list of prescription medicines that have been approved by the Therapeutic Goods Administration and subsidised by the government so that all Australian citizens can access medicines at a timely and affordable. The Pharmaceutical Benefits Pricing Authority decide if a new medicine will treat a significant medical treatment not already covered, and if the new medicine is more effective, less toxic, and safer than a drug currently on the PBS. A consumer will pay a co-payment. A concession card holder will pay up to $6.20 and a non-concession card holders pay up to $38.30. The Australian government contributes the rest. A safety net also exists for consumers who exceed a certain threshold of expenditure in a year. For concession card holders, the limit is $372. Then they have no cost to their prescribed medicines. A non-concessional card holder's threshold is $1,475.70. They receive prescribed medicines at a co-payment of $6.20 for the calendar year. The taxpayer pays for the PBS, and in 2013-2014, the annual government expenditure on the PBS was $9 billion. The annual cost of the PBS is determined by prices paid for drugs on the list, co-payments and safety net threshold levels, the number and cost of newly listed drugs, and the number of dispensed drugs by prescriptions.